Hi there. Are you a mental health provider who feels completely lost in these strange times? Well, stick with me, and together we're going to learn how therapists can prevent the next political assassination. Hi, everybody. I'm Dr. Jim, and today we're going to take a deep dive into a very powerful report that tells us how mental health providers can identify people that may become political assassins and ultimately disarm them with psychology. And we're going to be referring mostly to this very powerful report published in May of 2025 by the FBI's Behavioral Analysis Unit. It's called Beyond Belief: Preventing and Countering Violent Extremism in America. If you Google this report title, you can find it for free, and I really encourage you to take a look at it. It's brief, it's to the point, it's divided into very useful, practical sections. Today, we're going to be talking about two of those sections, mostly the parts that are going to tell us about how people become this way and ultimately how we can try to help them. So, we're going to talk about why people get radicalized. We're going to talk about the difference between radicalization and mobilization to violence and how that process kind of unfolds. Then we're going to pivot and we're going to start talking about how to help people that are going through this, identifying their background or their genesis, digging into the man's search for meaning and how identity is part of this as well. And then going into practical steps. How do we unwind radicalization? And then kind of wrapping up with some key takeaways. So let's start by talking about radicalization. People have to start somewhere. People don't just wake up and become murderous and, willing to go out and do violent extremist things. It has to start in their mind. So let's define some things from the report. The FBI says that radicalization is the process by which individuals come to believe that engagement in or facilitation of non-state violence, a phrase we're going to take a look at, is right to achieve social and political change, that this is necessary and it's justified. Coming back to your undergraduate degrees in your Philosophy 101 class, you may notice this non-state violence and it may click a little bell in your head and your memories. You see, we all believe in Western society and most societies that the government has a monopoly on violence. It's only okay to use violence if you're a police officer or if you're a military person. And then you have to be very monitored and restricted about when you're allowed to deploy violence without, anything bad happening to you. So radicalization, according to the FBI, is when a person gets so far in their thinking that they think it's necessary and justified for non-state people, individuals or groups, to use violence to achieve these social and political things. Now, radicalization is just a belief process, right? It's something that we are thinking. It's not action. Violent extremism, on the other hand, is when we are doing something. And the FBI says this is when we are encouraging, condoning, justifying, or supporting the commission of a violent act to achieve those political, ideological, religious, social, or economic goals. So radicalization comes first and it grows into violent extremism, which is where we see political assassinations taking place. So the FBI identifies several groups of factors. Now, let's keep in mind that no two violent extremists are the same, right? These people can come from all kinds of backgrounds and have all kinds of factors. But the FBI says there are some commonalities. One group of factors is these push factors. And the FBI says, hey, these are external things, usually grievance based, that drive the person toward violent extremism. So this person is facing unresolved grievances in the world, right? Real or perceived. They feel that they or others have been slighted and there are resentments that have come to them externally that have caused them to feel this sense of resentment toward a power, this sense of injustice or victimization, which can be a real thing. Their people group or individually may have experienced the short end of sticks and feeling that they have been treated unjustly and that they've been made a victim. Social isolation or rejection is a really common push factor, where externally this individual feels that they are not welcome, that they are not liked, that they are not respected. Experiencing economic hardship is a really big push factor because the person becomes disempowered, and ultimately this reinforces things like feeling like they are a victim and feeling this is unjust and feeling a grievance toward a system that they have very little control in and very little stakeholdership in. And then, of course, life stressors, really big disappointing things, divorce, being laid off of a job, experiencing a legal proceeding, being ill or having somebody in their family be ill. These are all external push factors that the FBI says can nudge a person toward radicalization. And then the FBI also talks about these pull factors, things that are more internal into the system that's pulling them in to this violent ideology. So these are incentive-based attractions that draw the individual into an extremist group or just an extremist ideology. And so some of those factors are feeling like you belong to this community, agreeing with them, feeling like you're welcome there, what you're saying matters, feeling like you have a sense of purpose or meaning. This group and their thinking gives you a way to interpret the world, and it makes you feel like you have a place in that system, a place in that philosophy, and now the world makes some sense. It also tends to validate your grievances. You say the system, this group is against us, this person is against us, and this organization or ideology says, yeah, you're absolutely right. Those things are true. And then we're also pulled in by the promise of power and influence that if we agree with these thinkings, if we say our piece and add to this song of extremism, that we're going to be important in that group, that if we contribute or if we're part of it, we're going to matter again. And so those factors are what the FBI calls pull factors. They bring the person in. And then the FBI identifies personal factors. Now, these are individual characteristics in life situations that do make a person more vulnerable to these radical influences. And these are things like mental health vulnerabilities, personality traits, thinking of things like narcissism or grandiosity, things that are a little bit more not quite pathological, but particular traits that might make somebody vulnerable to certain teachings that really appeal to them as a person. Also, the FBI points out that social skill deficits are a real danger here, because if a person has no way to connect to other groups that might cause them to be normalized or kind of create a little bit more of an equilibrium, then they can be radicalized because they don't have those skills to connect to other groups. Also, and this cannot be understated, a history of trauma or abuse. The FBI talks throughout their report, and we're going to talk about this in a second when we get to unmet needs. But a history of trauma or abuse is a really significant contributing factor to how people ultimately become hurting people who go on to hurt other people. And then the FBI points out that if a person has moral flexibility, they have kind of unstructured ideologies, then they can be, radicalized because these things don't sound offensive to them. It doesn't sting their conscience right away. And then, of course, this last thing, unmet needs, which the report talks so much about that we need to go a little bit deeper into. So, the FBI defines these unmet needs. Individuals vulnerable to radicalization often experience multiple coinciding, let's go backwards, sorry. Coinciding personal struggles, which may include feelings of hopelessness, frustration, failure, resignation, irrelevance, and or powerlessness. The FBI just stresses this throughout the entire report that at the end of the day, the most likely thing that's going to cause radicalization is a human who is experiencing these unmet needs, who's experiencing these emotions, which is going to lead to some dangerous mental states, which we're going to talk about in this presentation. And ultimately, the work of the therapist is going to be to identify these things and slowly unravel them. So, some other considerations about why people become radicalized. Keeping in mind that exploration of big ideas, scary ideas, radical ideas is not the same as actually being radicalized. And the report's very careful to say it's okay that people read books. It's okay that people watch YouTube videos. It's okay that bad actors have free speech and that humans are able to explore that speech. In fact, sometimes exploration deters people from bad ideas and causes them to be inoculated against those bad ideas and not accept them in the future. And also, the report says be careful, because just because somebody becomes radicalized does not mean that they are going to be mobilized to violence. The FBI is very clear in their report that they say the FBI is not the thought police. They're not here to tell you what you're allowed to believe, and nor do they care what you believe. They only get active in your life, and they only get active in this society whenever you become mobilized to violence. So the report says, therapists, please don't forget that we're comfortable with exploration. We're also fine, I guess, with radicalization. At the end of the day, the bomb we want to defuse is mobilization to violence. So let's zoom in on that. Let's talk about mobilization to violence. When people grow out of radicalization and into mobilization, what does that look like? Well, first, we've got to take a look at the way people think about violence. The report tells us that there's a difference between fixation and preoccupation. It says that Fixation is about that deep engagement with the violent extremist ideology itself. The report doesn't use this metaphor, but I'm going to use this metaphor. If you've ever seen the movie The Joker, Joaquin Phoenix obviously is kind of a violent vigilante kind of guy. He's an extremist. And so let's imagine that your patient is saying that they're watching this movie over and over again, or they're watching YouTube content or listening to things that are constantly examining and talking about extremism. Maybe it's violent videos. That person may be fixated on that. But it isn't personalized. It's just something that they are fixated and fascinated by. The jump is over here at preoccupation, the shift to a more active behavioral state where the individual is focused on and preparing for a specific violent act. So if they're talking about that movie, The Joker, now the patient isn't just watching it on repeat. They're starting to imagine, if I were the Joker, here's what I would do differently. If I were the violent person in these videos, here's what I would do differently. Now it's becoming what the FBI calls a preoccupation. This is part of the process of how a human goes from radicalization over to mobilization, fixation on violence into more of a preoccupation about it. And the FBI also takes us deeper and says, when you think about violence, there's kind of two different flavors. There's affective violence, which is impulsive or reactive. So this is emotional, right? This person is dealing with a strong emotion. They are feeling defensive about something and they feel like they're under threat. And so they behave violently, but it's not planned, it's just sort of reactive. On the other hand, the FBI defines predatory violence as planned and purposeful. And they point out that when we're talking about violent extremism, without fail, the majority of offenders plan and prepare for violence for at least a brief period before they conduct an attack. So there's a myth out there that a violent offender just snaps. Now, their attack may be something slightly uncoordinated because an opportunity has arisen, and so they're going to take that opportunity. But they don't just snap into this pattern of violence. There is something planned. There is something purposeful for at least a brief period of time. And the FBI wants us to understand that because they want us to understand that this is preventable. So, when the FBI looks deeper into the mobilization into violence, there's one big thing that they notice that is a huge component of this violence, and that is humiliation. And the report says a key difference between offenders who went on to commit an act of targeted violence and those who didn't was feeling humiliation. In almost 70% of instances in which there had been a violent offender, the FBI noticed that that person had perceived a humiliating event within 2 years of the attack. Friends, that's tremendous information from this report that if a person feels slighted, if they feel humiliated, 70% of those who ultimately cause an attack will have expressed that they experienced that idea. So that shows us when we talk about the move from radicalization over to mobilization, humiliation 70% of the time is that bridge that links those ideas. So when a person starts to mobilize, when they're starting to develop these violent intentions, the report says there are obvious things that we can look for. And as therapists, I think we're pretty comfortable with these ideas. We're already sort of trained to look for them. But an increase in risk-taking behavior, conducting surveillance, which doesn't mean standing across the street with binoculars. It can mean looking up flights. It can mean looking up a political individual and what their tour dates are, where they're going. It could just be reading up on them a lot more. So those potential targets are starting to be researched and investigated. Of course, a huge red light is seeing this patient starting to look for weapons, bombs, how to make these things, how to acquire these things, and then expressing intent. If they start saying, I think this needs to happen, I want to be the one who does it, and they're trying on these ideas, they're verbally threatening somebody online, they're writing about this in their communities and in their forums. These are all things that indicate that violent intention is brewing and may soon be on the horizon. So we've talked about why and how people radicalize. We've talked about how radicalization turns into mobilization toward violence. Now we're going to talk a little bit about the genesis of this, finding the why. And the FBI likes this phrase, finding the why, because they like this letter Y and the way it looks like a fork in the road. And so they want to kind of figure out the beginning of that fork in the road. When people are at that point where they could go one way or the other way, the FBI says this is where mental health providers have to figure out more about this individual. So, discovering those key starting points. And of course, the report talks about these unmet needs, which it describes as the driving force behind the radicalization process. We, as mental health providers, have to dive in and learn, where is this person feeling this aloneness, this hopelessness, this isolation? And also discovering the sense of connection that they may have, this sense of belonging. If they don't have belonging, that's a fundamental and common unmet need, and a lack of it can lead to that isolation and make these individuals vulnerable to bad ideas. And very key in the report is this idea of shame, which is different from humiliation but attached to humiliation. And it's a deeply ingrained emotion that can lead to this attack on our self esteem. Let's take a deeper look into shame, because the report really points out that this is the foundation of a lot of people's why. And the report says that shame is a set of complex ideas about the self, a deeply ingrained and often debilitating emotion that can profoundly impact an individual's psychological well being. And the report goes on and says that mental health practitioners can play a crucial role in addressing shame by providing a safe, non judgmental space for people to explore shame's roots and impact and reframe their experiences and develop self compassion. This page right here, more than anything, helps you understand that when we talk about preventing the next political assassin, we are talking about therapists, because fundamentally, the aspects that the FBI has realized lead to violence is this issue of shame, humiliation, unmet needs. These are psychological realities, and these are exactly the things that therapists are very trained and comfortable with dealing with. But a lot of therapists feel like they're not qualified to help somebody who's becoming a violent extremist. But when you understand this report, you understand that dealing with shame is very much in our wheelhouse. So let's continue this examination of ways that we can help by understanding that every human being has this search for meaning. And in our mental health training, we're usually familiar with the work of Dr. Viktor Frankl, who wrote the book Man's Search for Meaning. And so this piece of the report is talking about how humans have to find identity and how the ideologies offer that to them. So ways that this happens in violent extremism, the appeal of being an important person, when you've been a person who's a nobody, when you've been rejected by social groups, when nobody's wanted you to be part of their community, and now all of a sudden you can matter. You can matter if you never had a community, or you can matter inside of a community. So that desire to feel important and acceptable is a huge reward and a huge motivator toward violent extremism. Another thing the FBI points out is that we need to be mindful of what they call salad bar extremism. We have this idea that humans are going to be super consistent and super congruent, and that's just not the case. They're not. They believe all kinds of contradictions. And the FBI points this out, that this is a phenomenon where individuals will blend multiple, even contradictory extremist ideologies, and they'll try to weave all that together in an individual way. So the FBI report says that, hey, if you're a practitioner, try to focus on those common threads. Don't get too focused on exactly the aspects or ingredients of the ideology. Try to find common threads that connect them, such as the person's grievance or an obsession with violence. By finding these things, you're going to be able to unravel some of the ideology that's attached to it. Other aspects of interventions that the report talks about, it says we can assess if the individual has those unmet needs and if they're looking to be a somebody. And in therapy, explore that need and discover healthier ways to achieve that, encouraging pro-social engagement with healthier communities, assisting this person in navigating the world so they can find their people and they can find their identity, and also helping them see the functional analysis of their behavior. Why do we do what we do? What's the reward that we get from that action? And if we're aligning with extremist beliefs, how is that rewarding us? How is that making us feel valid? How is that making us feel like we belong? And then, of course, addressing any fixations on violence in a non-judgmental way, being curious about that, and telling them that it may frighten us or that it's not good. We don't want to endorse those kinds of thinkings, but doing it in that therapeutic way, being curious and non-judgmental so they can express their violent ideas in a way that allows them to consider them. And so this brings us to where in the report we talk about de-radicalization. How do we unwind this? How do we really help somebody question some of the beliefs that have given them bad ideas? So the report says that de-radicalization is an individual driven driven and gradual process. It takes time to sort out the complex motivations and personal drivers. And in therapy, de radicalization can be assisted by a gradual smoothing of rough edges through the processing of contradictions and obstacles in the ideology and trying to find long term goals. This is a very important slide because de radicalization is not an epiphany. De radicalization is not one important reminder, it's a slow process of unraveling what this person has landed upon and the beliefs that they've started to form. So, important considerations when we're trying to de radicalize somebody. One, the FBI reminds us that disengagement is a really important goal. For them, they say, look, again, we're not the thought police. A person can still be somewhat radicalized, and that's not our business. What we care about are the behaviors of violence. So, helping somebody step back from that mobilization and getting back into a radicalization that favors disengagement, that's not going to get violent, is a huge step in a positive direction. But the FBI also warns us, don't forget that belief perseverance is a thing. If you push too hard against radical ideas, if you try to sit there and debate radical ideas, it'll almost always go the wrong direction, right? Because humans have this instinctive reaction to reject evidence. In your mental health training, you were probably taught this phrase, psychological reactance, reverse psychology, how humans will fight against something that's being pushed on them. Well, the FBI wants you to remember that's going to happen here too. So if you just come out and push against radical ideology and just tell the person they're wrong, they're going to push back. They can't help themselves, and it's going to end up taking the conversation in the wrong direction. And the FBI also wants to remind us, be weary of transference. Now, as mental health providers, it's something we're always thinking about. But in this case, the FBI wants to remind you, hey, you're talking to somebody who has radical and extreme perspectives. You're probably going to feel afraid. You're probably going to feel very biased and hurt by some of this toxic thinking. You've got to monitor your own emotional reactions here more than ever. And you've got to find that empathy and that positive regard for the person. But remember, we can practice empathy, we can practice positive regard without endorsing this ideology. In fact, the very reality that we can like this human being for who they are and have that be a very separate thing away from their ideology gives them space to question the ideology and not associate that ideology with their own personal value. Other things the FBI wants us to remember with de radicalization is embracing certain postures. Yes, identifying their why, understanding how this ideology benefits them in really practical ways or gives them some kind of psychological relief for some of those unmet needs. Being patient, because this is a non-linear process. There are no 7 stages that go in a straight line. This is going to toss to and fro. It's going to steer from one side of the road to the other. It's going to be 3 steps forward, 2 steps back, and 2 steps sideways. Be patient and lean in on the process. Also, have the posture of constantly managing expectations, helping this person understand that we are still going to have setbacks. We are still going to get discouraged. There's going to be days where this trying to live our lives differently away from radicalism isn't really working for us, and that's okay. But those setbacks are going to be overcome with time. And then another thing the report talks about is that therapists should be posting what they call billboards and exit ramps, constantly creating opportunities to reconsider the conclusions that this patient has, to help them find alternatives to violence. These are the exit ramps away from bad actions, and billboards are planting thoughts, giving them possible other ways to think about situations that don't lean toward radicalism, that don't lean toward mobilization to violence. And lastly, the FBI says, hey, don't forget about culture. A lot of radical ideology is very entrenched in heritage, in religion, in an ethnicity, in an experience that's unlike other people's mainstream experiences. And because of that, you need to lean on your training to be very curious and non-dismissive about culture. These grievances may be rooted in truth. We just want to steer those grievances into a positive and healthy direction that isn't rooted in radicalism or mobilization to violence. The report also wants to remind us that only 25% of violent extremists have any diagnosable mental illness. That's about consistent with the general population of humans. About 25% have a diagnosable mental illness. So, With that being the case, we are told by the FBI, don't make mental illness your primary focus. Instead, make it about mental wellness. Because if you're constantly looking for a diagnosis, this person may just become bored with therapy and walk away. But if you're making it a welcome place where they can just focus on improvement and growth, then you're going to attract them and then they're going to be able to stay there and really have meaningful work. So, addressing vulnerabilities without assuming just a completely causal link between mental illness and violent extremism, understanding whole person health. Other things that are obstacles to de radicalization. The FBI says, they have a phrase. They say there are these things that they look for called seemingly unimportant decisions or SUDs, which is funny because in mental health, we hear SUDs and we think substance use disorders. But in the FBI, they say, hey, watch out for this. These are these seemingly benign, small choices that don't seem important, but they can ultimately bring a person back to certain behaviors. It's checking in with a friend they've lost touch with, it's answering a phone call or getting a text. It's these things that just don't seem important, but they want mental health providers to be on the lookout for this because this can cause a person to regress and relapse back into bad ideology. Of course, the obvious, the FBI says watch out for cognitive distortions, right? Those biased thinking errors, black and white thinking especially. There are good guys and bad guys. You are with us or you are against us. You are part of the raging solution or part of the stagnant problem. These are known cognitive distortions, and the FBI says a therapist should be equipped to help somebody challenge and consider those in a broader context. And another new phrase that the FBI has coined here is extreme overvalued beliefs. And they say, these EOBs, which again, as healthcare providers, we think of insurance documentation and benefits, but nope, EOBs here means extreme overvalued beliefs. And they say the way we want you to remember this is that it's a not delusional thing, right? This person's not making this up. They're not, quote unquote crazy, but it is very rigid. And because of that rigid inflexibility, it can motivate extreme acts. Because if you believe in a black and white way that this one symbolic action is extremely important, then the only thing that goes along with that is something extreme, right? So we want to help them right size their beliefs about certain things in order to react in a way that feels practical and realistic. And therapeutic interventions that are useful that the FBI talks about, taking a relapse prevention kind of model that's looking for those SUDs, those spontaneous things that don't seem like a big deal, that anticipates that the same way that we would think about somebody trying to avoid relapse into alcoholism. Also using cognitive behavioral therapy, of course, to try to dismantle those cognitive distortions, and perhaps using ACT to help individuals accept difficult realities and pain that they're feeling rather than being dominated by them, nudging them toward those pro-social goals, helping them quote unquote touch grass, get back into the world and reconnect with real communities of real people. So let's wrap up this report on the report with some key takeaways that things mental health providers should remember. So remember this, individuals contemplating how to change, they struggle with that how to, right? Yeah, they're open to it. Yeah, they realize they're on the wrong path. Maybe they're ready to sit down and talk about it, but just knowing that they're ready to talk about it means that how to is going to be elusive to them. And that's where we step in. Our job is to be the ones that help them explore the how to change, trying on new ideas, trying on new lifestyles and new conclusions. Also, the FBI wants you to remember that change is going to begin with you understanding this individual's thoughts, feelings, and behaviors, their unmet needs are everything. And we have a responsibility to dive deep into that person's life and ultimately understand them on a personal level. The FBI says look for the why in the road, that fork, that moment of beginning. These crucial moments are going to be important for us to visit with this person because only by understanding that moment and helping the person reconsider the radicalization decision are we going to give them the opportunity to turn the other way and see a brighter future with better choices. And then lastly, the FBI says, don't forget, focus on their worth and needs. If you, the therapist, are focusing on this human, if you are healing this person, then you can de-radicalize them. That will demobilize them. And that'll make it so the FBI never has to get involved and we don't have any violence whatsoever. thank you for taking a look at this with me. Again, I want to remind you that everything I'm presenting today is coming from an FBI report published in March 2025 by the FBI's Behavioral Analysis Unit. You can find it. It's called Beyond Belief: Preventing and Countering Violent Extremism in America. Google that, download that report, read it, pass it around among your colleagues. It's so much more than what I've presented today. I really think it's something we should all be reading as we enter these strange times in American history. Anyway, thanks again for watching this. Thanks for thinking about these hard things. Thanks for what you do for mental health. I'm Dr. Jim, the Sin City Shrink, and I'll catch you next time.